Hi, welcome to Jenny's Belly with myself, Jenny Brannigan from Total Physio in conjunction with The Mooney Show. This week we're going to talk about posture, so your shoulder blades, your ribs, your head and neck. There's a very gradual change in posture as your pregnancy will progress, and that can be due to the growing breasts, to the enlarged size of your uterus as the pregnancy progresses, and that can lead to rounded shoulders, to a forward poking chin as your head pokes forward, to general hunching through the shoulders. So it's very important that you try and maintain your good upright posture, particularly as the pregnancy progresses and you feel a little bit more inclined to slouch. So before we start exercising, it's very important to heed this warning. If you feel unwell, if you have any bleeding or fluid loss, or you just simply don't feel right, stop exercising immediately and contact your GP or obstetrician without delay. So we're going to go through a couple of exercises. The first one is a very useful one. A lot of people ask me, how do I know when my posture is correct? How do I get into a correct posture? So I'm going to show you now how to get into a shoulder blade neutral position. So we're sitting up on a gym ball for this. You can do this sitting in a chair, you can do this sitting on your mat. And you're going to place one hand and then the other up on top of your head. You're going to shrug your shoulders right up towards your ears, widen the elbows then, and then push the shoulder blades right down towards the floor. And keep that position and then relax your hands down by your sides. So this is an excellent position to practice getting into, because ultimately the more you practice this, the more you'll then be able to assume that position without any of the palaver of the arms and the shoulders moving. So it's very important. We'll do it one more time. So pop one hand and then the other up on top of your head. You're going to shrug your shoulders up towards your ears, widen the elbows out as far as you can, and push the shoulder blades right down towards the floor. Holding that position now, relax the arms down by your sides. So you should feel the shoulder blade muscles working, so the muscles between the shoulder blades, you should feel nice and straight and upright, and of course you should have no pain in this position. So the next thing we're going to do is we're going to do a little bit of movement of the shoulder blades to make sure that they're nice and flexible. So we're going to bring the two arms out in front, make sure that your shoulders are nice and relaxed, and as you breathe into the sides and backs of the ribs, you're going to just stretch the fingertips as far away from you as you can. As you breathe out, squeeze those shoulder blades back together. So no hunching of the shoulders up at all. You want to make sure that the shoulders stay nice and relaxed. Inhale, reaching the fingertips forwards as much as you can. And as you breathe out, always working the stomach muscles as usual, but squeezing those shoulder blade muscles together. Okay? The next thing we're going to do is we're going to inhale, and this time we're going to bring the shoulders and the arms upwards. And as you exhale, you're going to push them all the way back down to the floor. So you're gliding your shoulder blade up and down on the chest wall with this one. Inhale, coming all the way upwards, and exhale, pushing the shoulder blades all the way back down onto the floor. Okay, now we're going to go into our third exercise, which is some arm circles in this position. So as you breathe in, you're going to reach up to the ceiling, trying to make sure that we don't pop forwards with our with our ribs, I should say, and exhale to complete that circle. So this is a very nice one for opening out the front of the shoulders. Inhale and reaching up, keeping those rib cage from popping up, and exhale right around into a big circle and relax. Okay, the next one we're going to work on is to try and open out the rib cage a little more. As your pregnancy progresses, the size of the bump can push up into the rib cage, and particularly in sitting, it can be quite uncomfortable. And of course, if you have a baby's foot kicking in there as well, that can certainly add to the pain. So this next stretch is very good for releasing that. So this is a very nice one for opening out the rib cage. And as the bump gets bigger and bigger, you can get a lot of pressure up into the rib cage, just because there's simply no more room. So the uterus starts pushing up in underneath, and sometimes you get a few baby kicks right in under there as well, which will certainly add to the pain. When you're sitting down, it'll compress that area and it can certainly add to that pain as well. So we need to try and be able to stretch that out. So we're going to start in this position, again, our all fours position. Hands are directly underneath the shoulders and the knees are directly underneath the hips for nice balance. Be careful if you have some wrist issues here, but you're not going to be leaning on the wrist for too long, so it's not as much of a worry in this particular exercise. So what you're going to do is you're going to roll backwards to bring your bottom in contact with your right heel, then your left heel, and then coming back up to your starting position. So inhale to start the circle, and exhale to complete the circle. Inhale to start the circle, and exhale to complete the circle. And always in the opposite direction so that you keep your body nice and balanced. Coming back up, inhale to start the circle, and exhale to complete the circle. Okay, one more time on that side, keep it balanced. and exhale to complete the circle. And that movement helps to mobilize the lower parts of your ribs. It's a very effective one. So our final exercise is an excellent exercise, regardless of whether you're pregnant or not. You're going to bring the feet hip distance apart. They're about a foot away from the wall. You want to tuck in the tailbone between the legs so that the dimples in the lower spine press into the wall, your lower ribs attached to the wall, your shoulder blades attached to the wall, and the base of your skull attaches to the wall. So it's not the back of your head, it's the base of your skull. So it's an excellent stretch because all you're doing is aligning your bony landmarks up against a straight wall, and then you're going to breathe in, and you're going to exhale as usual in this position, just to feel that stretch from between the shoulder blades right up to the base of the neck. It's a very effective stretch, and it's one that you should try and do every morning. After you've been in bed for a couple of hours not moving so much, you'll feel a little stiffer. And just 3 or 4 breaths in this position every day will make a huge difference to your overall posture. So nice and relaxed through the legs. Your bony landmarks are aligned against the wall, and nice breathing here. So that's a really nice one for your posture. And as I say, it can be done every single day. It's perfectly safe to do. So that's our 4th week then. There's 5 exercises there. Again, there should be no pain on any of these exercises. I hope you enjoyed them, and we will see you next week again.